Today, I am pleased to introduce Jerry J. Casassa, DMD. Jerry received his Bachelor of Science in Biology from Boston College and earned his DMD degree from Tufts University School of Dental Medicine, graduating in the top 5 of his class. He was elected to the Omicron Kappa Epsilon National Dental Honor Society for his outstanding achievements. He's an active and accredited member of the Academy of General Dentistry, earning a fellowship award in 2001. He has also served as the president of the East Middlesex District Dental Society. Dr. Casassa is a practicing full-time dentist with nearly 20 years of clinical experience. He heads a highly successful preventive, cosmetic, and implant dentistry practice with 2 locations north of Boston. He is an accredited member of Dentistry for Diabetes and continues to evolve in his profession by implementing the latest technology in his practice and for the improvement of his patients' oral and overall systemic health. And today, Dr. Jerry will share one of his favorite areas of concentration, the mouth-body connection. Jerry, all yours.
Thank you, Lydia. Good evening. I'm Dr. Jerry Casassa, and welcome to the presentation, The Mouth-Body Connection, Periodontal Disease, and the Oral Systemic Links. Currently, not all clinicians and researchers agree that there is a link between periodontal disease and systemic disease. For some, the research is compelling, and they have accepted the links as fact, and subsequently modified the way they practice dentistry. For others, the evidence is still inconclusive, and so they require more research to be done before they become convinced. Therefore, you will need to evaluate the evidence for yourself and decide whether or not the links exist, and ultimately decide how you will utilize this information to change the way you practice. Let's begin with our objectives. Recognize potential life-threatening conditions. Institute effective clinical protocols and treatment therapies. For discussion, we will review the potential association between periodontal disease and systemic disease, assess the relevant research data and discuss if this association is biologically possible, understand the role C-reactive protein, referred to as CRP, plays in the immune system response, review the etiology and the available options for treating periodontal disease, and discuss some of the blood tests being used in the office and its significance. So what exactly is the connection between what happens in your mouth and your overall health? Before we can answer this question, let's first define periodontal disease. It's an inflammatory and infectious disease. It destroys the gums and bone that support teeth. It is caused by a growing colony of living bacteria called plaque. Dental plaque is a biofilm. Biofilm is found everywhere, in our lakes, rivers, ponds, plumbing lines, prosthetic devices, contact lenses, cardiac catheters, at the bottom of a vase when flowers have been left there for a while. It's estimated that 65% of all disease is biofilm-induced, examples of which include infectious kidney stones, tuberculosis, cystic fibrosis lung infection, SBE or subacute bacterial endocarditis, and periodontal disease are all biofilm-induced diseases. Biofilm grows as stacked layers of different species of bacteria. It does not grow with only one species of bacteria increasing in number. The early colonizers are the first bacterial species that colonize biofilm. The first 2 species are Actinomyces and Streptococcus. These early colonizers are considered beneficial species. At most, they can cause gingivitis. More than 500 bacterial strains have been identified. These bacteria are freely flowing in the mouth. They do not bind to the biofilm until they receive the chemical signal to do so. Once the early colonizers bind, they send out a signal for the second group of bacteria to bind, and the second group send out a signal for the third group to bind, and so on. Point is, the second, third, or fourth group of bacteria that bind to biofilm can never be the first group of colonizers. The bacteria can only bind when they are given the chemical signal to do so and in proper sequence. A biofilm is composed of bacterial microcolonies, fluid channels, and a primitive communication system. As the plaque develops, a dense gelatinous slimy matrix is formed. This protective extracellular slime matrix makes the bacteria extremely resistant to antibiotics, antimicrobial agents, and host defense mechanisms. Mechanical removal is the most effective treatment currently available. Antibiotic doses, for example, that kill free-floating bacteria need to be increased as much as 1,500 times to kill biofilm bacteria. And at these high doses, the antibiotic will kill the patient before the biofilm bacteria. The periodontal pathogens are the later colonizers of plaque biofilm. There are 4 species in particular that can cause periodontal disease, and they are Porphyromonas gingivalis, Treponema denticola, Tannarella forsythensis, Actinobacillus actinomycetum comatans. They are all gram-negative anaerobes. Massive biofilms exist in the gingival crevice. A study done at the University of Michigan estimates that depending on the pocket depth, the number of bacteria in a pocket varies between 10 million and 1 billion. For example, a 10 to 12 millimeter pocket can have 1 billion bacteria. A 5 to 6 millimeter pocket can expect to find 10 million bacteria. So we start with dental plaque, a biofilm composed of millions of bacteria. These bacteria are in direct physical contact with the ulcerated pocket epithelium. The ulcerated epithelium is the entry or portal for the bacteria into the circulatory system. We call this a bacteremia, and it most commonly occurs during chewing and brushing. By definition, bacteremia is microorganisms in the circulatory system. It consists of live bacterial cells and their endotoxins. When bacteria break down, their cell walls break down into 3 components: lipids, proteins, and carbohydrates, referred to as LPS or lipopolysaccharides. Evidence suggests that the lipid portion is the most toxic because it stimulates osteoclasts, thus leading to bone loss. The inflammatory response is the body's response to the bacteremia. It causes the release of mediators and enzymes from the bone marrow. Inflammatory mediators such as cytokines, TMNs, B cells, T cells. Enzymes such as collagenase, protease, gelatinase, elastase. Collagenase, for example, destroys the periodontal tissues, namely the collagen. Protease breaks down collagen and proteins. Gelatinase breaks down the gelatinous matrix around the biofilm. Elastase breaks down the elastic fibers.